It's constantly changing, but right now, the whole state of Maryland is seeing a drop in overdose deaths, which is great. I mean, one is too many. So far this year, documented in Talbot, people that actually reside here, we have one documented overdose death. We think we just had another one recently, but it'll take a couple months before it gets reported. We're seeing less and less reported non-fatal overdoses, and I think it's because the community, there's so much Narcan in the community now. And one thing that we did with Talbot Goes Purple is we were training people and having going to, you know, Rotary clubs and Elks and training people and going to businesses. And we have the one program, we'll install a box in your business, train your people in Narcan, have Narcan in your business. And we've done that in Talbot County for the last 3 years now. So we're seeing less reported overdoses, but I make no mistake. I mean, those non-fatal overdoses are still happening in our community. But I think we're probably one of the best trained counties in the use of Narcan. And I think part of that's Purple Health Department, you know, a lot of partners involved in that, which is a good thing. We're seeing less and less of that where people are calling 911. Some people are transporting to the hospital. Some people are just using Narcan and recovering. So it's a good thing that more people are living, but we still have a problem. And you know, when we first started this 9 years ago, Talbot Goes Purple, we had a lot of heroin that we were seeing. We're still seeing some heroin, but everything is laced with fentanyl. Everything that the Drug Task Force is seizing as far as heroin or cocaine and straight fentanyl, it's fentanyl. We're seeing more and more counterfeit pills. You know, they're all manufactured by the cartels coming across the border. And that's the path to death, this terrible thing. But in the past, 9 years ago, was a period of, a good period of addiction to heroin. You know, the pills, they got addicted to the pills in the past, the pain pills, and then they went to heroin. And then it was a lot of people in their late 20s, 30s, and even 40s that you would see who had overdosed. Our concern now is the fastest group of rising deaths are young people because of the fake pills, where DEA calls, the Drug Enforcement Administration calls it One Pill Can Kill campaign. And we're really pushing that this year in Talbot Goes Purple because we're finding that young people that experiment with prescription pills, if they're bought on the street, there's a 50% chance that there's fentanyl in that pill. And they're counterfeit pills and you can't tell the difference. So what we're doing is with our school resource officers, putting some posters up in their offices and in the schools saying, hey, one pill can kill. Can you tell the difference between the real pill manufactured by the pharmaceutical company and one manufactured by a cartel? And you can't tell the difference.
What are they selling it as again?
They're selling it Oxycontin or Percocet. And they look just like those pills. They have pill presses that they're just putting that stuff together.
So how can you tell?
We can't. We have to send it away to be tested.
Oh, okay. I thought you were educating people on.
No, we're trying to educate people on you can't, unless it's prescribed by a doctor and it's bought at a pharmacy, that's the only way that you know that this is a pill that you should take. So the experimentation with pills, we're trying to teach our young people, there should be none. Don't try it. Unless it's prescribed to you, unless it comes out of a prescription bottle from your doctor, don't even try it because all across America, kids are trying it one time or the second time, and they're just not waking up, and then they're dying, which is a really scary thing for all of us. Thankfully, we've had a couple of those cases in years past where a fake prescription pill and somebody overdosed and died, but we haven't seen it in mass like they have in other parts of the country and other parts of Maryland. The other concern we have this year is, you know, there's going to be dispensary or two opening in Easton. It's mandated by state law for marijuana. And our concern is the young people because there's tons of studies out there that show that the younger you start using marijuana, damages your brain. We'll see increased ER visits, emergency room visits. So we're really trying to focus a little bit of our message this year on that. Like, this is not the same marijuana. Parents, grandparents, this is not the same marijuana that you might have experimented with 30 years ago when you were in high school or college or whatever. It's very different.
So that's not coming from the dispensaries. These are
Correct.
These are
Black market marijuana. But, you know, on the other hand, you're seeing gummies and stuff coming from the dispensaries, and we want people to understand and parents to understand you need safe storage with that stuff. You can't have that stuff laying around where kids, even toddlers, can get their hands on it. And we have had that happen in Talbot County. So we want to push out some messages this year in that regard to, you know, alert parents to get them talking with their kids. You know, one of the other things we really try to push with the kids in the schools is the Good Samaritan law. And if you ask a bunch of people my age what the Good Samaritan law is, they'll tell you that, oh, it means you can stop at a traffic accident and help somebody and you're protected. Well, that's not what we're talking about. We're talking about if you're at a party, a young person's at a party, whether it's an underage drinking going on or drug use going on, and somebody's in distress, medical distress, they can call 911 and nobody at the party can be arrested for the alcohol or small amounts of drugs. I absolutely think that we're getting better. I think as a nation, as a country, as a state, we're getting better. The numbers are dropping, and I think the numbers are dropping because of all those people have come together. Doctors now understand the pill addiction, you know, but they didn't understand that 10, 15 years ago. Parents didn't understand about prescription opiates. Now they know about prescription opiates. And I think we are getting better. You can just see that in the numbers and the number of cases. But sadly, there's still room to improve.